Good afternoon. Thank you for coming. My name is Tim O'Hearn, County Administrator for Schuyler County. Joining me this afternoon are key county representatives as well as our partners from Schuyler Hospital. We felt it appropriate to brief the community on the response, both our government response and the healthcare response to the COVID-19 outbreak. As you're all aware, this is an unprecedented event that is challenging every level of government, and Schuyler County is not exempt from that by any means. Given the recent executive orders from the governor, Schuyler County government will be making a number of rather dramatic changes in how we operate. We, effective today and by tomorrow at the latest, will be reducing our workforce by 50%. To deliver services differently. Our intent is still to provide all of our services, but where possible, we will be doing so remotely. Essential services will absolutely be maintained, and a physical presence will be maintained where necessary. In other cases where we can accomplish the same objective, but do it remotely, that is being done. Through technology and a very cooperative workforce. We will be making efforts to remotely locate staff. We will be taking a number of specific steps to, again, change how we deliver the services, but hopefully not diminish them dramatically. As a overview, and I will be asking some of our county staff as well as the hospital staff to elaborate on specifics, but to highlight some of them, we effective today are closing our public works facility to public access, and we're moving that staff to split work weeks and cutting staff there by 50% by working alternate weeks. Other office buildings remain open. However, the Department of Motor Vehicles, effective tomorrow, will be moving to an appointment system, as will the county clerk and treasurer's office. We are encouraging all members of the public to utilize email, phone prior to visiting our complexes, and we hope to be able to deliver the same level of services just in an alternative fashion. Some of the highlights I mentioned. Our Department of Social Services at this time remains open, but is strongly encouraging the public to apply for benefits by telephone or online. Michelle is handing out a summary of all of these changes. We've also posted them on our website. For Schuyler County residents experiencing homelessness, we ask them to report to the Sheriff's Office for assistance as we would for after-hour coverage. Community Services, Mental Health Agency, the mental health clinics and its therapists will be fully operational, but will be operating by teletherapy during the state of emergency. The clinic will be contacting individual patients regarding appointments and discussing the teletherapy process. Information regarding contact and other specifics is available on our website. As I mentioned, the county clerk and DMV will be moving to an appointment-only system. Visitors to our office buildings will be screened and appropriate precautions taken where necessary. Public health, as you can imagine, is not affected staff-wise. They are at the front line of this, and if anything, need more resources. We will continue to support all of the public health efforts as we work with the hospital and our staff to address this outbreak. I should also note, and Deb Miner, our public health director, will be elaborating on this. At this time, we have no confirmed cases in Schuyler County. We fully expect that that will change, as does every county in New York State. All of these measures are taken out of an abundance of caution and certainly in a proactive fashion to help flatten the spread of this disease, the curve of the spread of this disease, and to do our part to try and combat this from a public health standpoint. Our buildings and grounds operation will be fully operational, and staff have been assigned cleaning and sanitation duties in all of county facilities. Our probation is moving to reduce staff by 50% and working remotely in dealing with clients. For the Treasurer's Office, foreclosure proceedings have been put on hold for the time being. Staff are working remotely where practicable, and if possible, we request that payments be mailed to the Treasurer's Office for tax purposes. The County Attorney's staff will all be working remotely. Our Planning Department will be working remotely, and contact information for all is on our website. We are closing our records management function temporarily. Our weights and measures will be working remotely, but suspending all retail operations and focusing on industrial and agricultural inspections. Civil Service and Human Resources offices will not be open to the public, but will be functioning. The District Attorney's Office will no longer take walk-in appointments and will not be making court appearances unless mandated by a court. They will not be presenting cases to the grand jury until further notice, and will not be handling traffic ticket reductions in court. That will be only by email and mail only. The public defender will still be accepting applications for any active family or criminal court matters in Schuyler County. Call the office directly to make appointments, and where possible, work will be done remotely there as well. The Board of Elections is still operating remote where possible, but as you're aware, there are elections that are at hand. The local elections have been postponed until April, but the petition process for the major parties is underway, and the Board of Elections will be working remotely except as where necessary to physically receive correspondence and formal documents as required by law. In the Office for the Aging, we have, as of yesterday, closed all of our congregate meal sites, have increased our outreach to local residents and increased our home delivery of meals following distinct protocols in terms of how we interact with the clients that we serve. But again, as I said at the beginning, our intent is to continue to provide the services, deliver the services. We're just changing the method in response to the public health needs here. There is a separate handout for the Office for the Aging that details all of the functions they provide, and will continue to do so, just in a different manner. So at this time, to talk further about the law enforcement changes, I would invite Sheriff Yesman to come forward, followed by Public Health Director Deb Miner, to talk about the county's response and give you updated statistics on that. But Sheriff, would you like to touch on that?
Thank you. Afternoon. Like Tim said, this is unprecedented, especially for law enforcement, something of this magnitude. And we're instituting some procedural changes for our office. When calling 911 or our non-emergency number, you'll be asked to provide a callback telephone number. A deputy will most likely contact you via telephone before arrival to assess the need for an in-person interview. For minor reports, the deputies will most likely provide you with the report number and complete the report without personal interaction. If needed, please be prepared to step outside of your residence to meet a deputy in an open environment. This is to reduce us introducing something into your residence, or if you're exhibiting symptoms, not to infect our people. This is consistent with the recommended social distancing to prevent the spread of illness. Additionally, effective later today, the lobby of the public safety building in Watkins Glen, the jail building, will be closed to the public. There's a phone in the foyer you'll be directed to pick up. That will ring directly inside to the dispatchers, who will have someone come out to talk to you if needed. If you're requesting services, a deputy will come around and speak with you outside the public safety building. Also, later today, the civil department will operate on appointment-only basis. People can call 607-535-8226, which is the civil office, to schedule an appointment, whether they have any business with our civil office. We'll continue to respond accordingly to emergency calls for service. We'd like to thank everyone in advance for their cooperation. We'll return to normal operations as soon as it's permissible. Thank you. Also, one other thing. Effective today, visitation in our jail is suspended. No group sessions will take place. One-on-one interviews, we have space in non-contact visitation, and that can be done. And in an effort to reduce the impact on our inmates and their families, we're working with our phone provider right now to provide several free phone calls for them a week. They'll probably be like 5 minutes in duration, but just something extra so they can have contact with their family that they normally would get during visitation. Thank you.
And to provide a current update on the public health status, Deborah Miner, Public Health Director.
Thank you. And probably one of the most important things that you want to hear at this point is that as of today, we do not have any confirmed cases of COVID-19 in Schuyler County. We have had a total of 5 folks testing that have come back negative, and we have 5 folks who have been tested and we are waiting for their results. I do anticipate I'll probably have some of those results before the day is up and the others within 1 or 2 days. At Public Health, we're working with the residents who may have been exposed to COVID-19. We want to ensure their safety and their health, and also the safety and health of the overall community. We're working with the hospital and the providers to facilitate the confirmatory testing that is needed when it's ordered by a physician. We're also working with the providers and the residents needing testing when isolation, monitoring, or quarantine is warranted. At this time, we do not have any residents in Schuyler County where an order of mandatory quarantine has been issued. At this time, we need everyone's help to help flatten the curve. Social distancing means avoiding close contact with other people. We need community members to help us with this, to make it be successful. Please stay at home as much as possible. If you're going out, try to keep at least 6 feet distance between you and others. Always avoid crowded places. And for example, if you're going to the grocery store, please don't take your entire family of children with you. Try to limit it to just the one person that needs to go and get what you need and come back home. Please postpone appointments or see if you can do them by phone or remotely. Sign up to get your prescription shipped to your home if that's possible. These actions will help us to slow down how quickly the virus can spread in our community. This is what we mean when we say flatten the curve. It is very important that we slow this curve, that we slow the spread of the virus to make sure that our hospitals and our providers have adequate time and resources to treat the people that are most sick and need their care. Thank you.
And I'd like to introduce Dr. Marty Stallone, CEO of the Cayuga Medical System, and also thank the hospital, both Cayuga and Schuyler Hospital, for their strong partnership and support. We hopefully will continue to work together as a team to address the health issues, and we're very thankful to have you as partners. So, thank you very much, Tim.
As Tim mentioned, my name is Dr. Marty Stallone. I'm the president and CEO of Cayuga Health System. Also serve as the president of Cayuga Medical Associates. That's a multi-specialty practice supplying many physicians, primary and secondary physicians, into Schuyler County. So I'm coming from the health system perspective. We work very closely with the personnel at Schuyler Hospital and Becky Gould as president. Schuyler Hospital, as you know, is a member of Cayuga Health System. There will be comments from Becky about the preparedness that's happening right now at Schuyler Hospital. I wanted to speak from the system perspective. In Tompkins, we did activate our incident command at the health system. There is a liaison function with Schuyler Hospital, and we're sharing best practices. We've done a number of noteworthy actions. My main message is really that there's a high degree of preparedness, and preparedness actions are happening so that the wave of cases that we're anticipating and hoping that social distancing prevents, but should that happen, we would be prepared to act. Recently, we restricted access at Cayuga Medical Center to a smaller number of entrances, and we're screening employees who come into the building, including all other visitors. There are restricted visitor parameters that are constantly in evolution, but effectively we're trying to reduce the chance of the virus being brought into the hospital out of a sense of protecting our patients. We've also opened a community sampling site in Tompkins County. At the present time, that sampling location where we collect viral samples to be sent to a commercial or government lab to be tested, that is only for a physician's order. That service extends to the physicians in Schuyler County. We're trying to reduce the number of sampling events that happen in our emergency room, our urgent care centers, and in the private practices. As you may or may not appreciate, when a sample is taken, it's a logistical event where the staff have to be in personal protective equipment. Everyone in the building needs to effectively have their whereabouts known, and if the sample becomes positive, there's burden put on the public health department to track and make sure that there wasn't any contact that would then mandate quarantine and other events that are unwanted. So we felt this was a good technique to consolidate that as a community resource. We're also working with community partners in an agile way to address a list of problems. You may have heard in with all the school closings that there's a question of essential personnel finding it increasingly difficult to report to work at a time when we need them even more. So we're working with community partners to address problems like that. Additionally, there are no fewer than a dozen teams to address special aspects of this problem, ranging from sampling, ranging from supply procurement, ranging from protocols to protect staff and patients, and the like. We are complying with Governor Cuomo's orders with respect to closing gyms in our system and taking other steps that are in the interest of protecting our community. This is a rapidly changing situation. This is what we prepare for. This underscores the importance of hospitals and medical practices in our community. We are very proud how they have stepped up to the plate and are responding to the need. We have a great degree of readiness. I think the county is very well served, and we look forward to agilely working with the public health and local authorities to meet this problem. I'm going to hand it off to Becky to make some comments, and I think we'll be here to answer questions as well.
Thank you, Dr. Stallone. My name is Becky Gould. I'm the president at Schuyler Hospital. I want to thank Marty and CMC for their partnership with Schuyler Hospital during this time and making services available such as the drive-through testing facility that they are working through. Specifically at Schuyler Hospital, we are taking measures to keep our patients, residents, visitors, and staff safe. And some of those measures include limiting entrances at the facility. We currently have 3 entrances available. If you need services, we are open and available to the community. We are here for you, but you will need to enter either through our ED, our rehabilitation door, or the Seneca View main entrance. At that time, we want you to be prepared for what's going to happen. There will be a screening that takes place at that time. It really consists of a short questionnaire and also having your temperature taken. The precaution for having the temperature taken is a directive from Governor Cuomo in relation to our long-term care facility. So that is not something that you may encounter when you go other places, but is something that you can expect at Schuyler County. Other things specifically related to our long-term care facility include the fact that we have to restrict visitation in the SNF for everyone. There are very few circumstances where Department of Health is allowing visitors, and we want you to be aware of that. To that end, we have made iPads available to our residents there, so they are able to communicate with their families. In addition, all of our staff are wearing masks, also directed by Department of Health. For the Schuyler Hospital proper, we also want to take precautions there. We are limiting visitors to 1 at a time. This includes our inpatient services, our ED, as well as our ancillary services, and we are requesting that you do not bring children with you under the age of 18. So please keep that in mind and be prepared when you enter our facility. In addition, as many of the others have noted, we are limiting all non-essential meetings and events at the hospital. Michelle Benjamin is keeping that updated along with others to make sure that you are aware of the events that were scheduled that will be rescheduled in the future. We did want to let you know that Montour Falls Primary Care does have a COVID hotline open and available. It is open during our normal office hours. You simply call the normal Montour Falls Primary Care number and select option 9. At that point in time, you will be sent to an LPN for screening. So we wanted to make sure that the community was aware of that. We also want you to have confidence in us that we are working behind the scenes, round the clock, to make sure that we are prepared in the event that we receive a positive COVID-19 patient. We are working through all of our facilities and departments to be sure that we are prepared. We are working to be proactive in this event instead of being reactive. And of course, we wanted to let you know that we are continual communication with all of our county agencies represented here today. That's pretty much the specific information for Schuyler Hospital, and we will open it for questions.
Do we have any questions?
Masks, gloves, there's some items that are starting to become more scarce in different hospitals. How are you guys?
Sure.
Do you want to talk about that from a system perspective?
Sure.
As I mentioned, we have a number of teams handling different facets of this problem. One of them is supply and PPE procurement. We have reached out to all of our vendors, and as you pointed out, there are scarcities. We have strong supplies at this point. Those are limited at this point in terms of the replenishment that we can accomplish, and as you might expect, as fears are heightened, those supplies are being used at a faster rate. So we are expecting supplies to, the production of these supplies to increase on the order of weeks, although bear in mind everyone in the country is looking for the exact supplies at the same time. In fact, not even the country, it's really the world. And so we're part of our team was a novel PPE and supply procurement. And so we're actually reaching out to partners. For instance, we reached out to Cornell Health with the students being sent home, and we sequestered their supplies and we're centralizing them and using them for this purpose. We're also prioritizing the people who are at the front line of the problem. So it's the frontline caretakers who are sampling people who are at risk and have a credible story to be a person of interest, that we would always make sure that they had PPE. But again, as you might expect, anyone walking through the halls would feel more comfortable in a gown and a mask. And so we have to make some policy decisions. That's another one of our teams. We're constantly educating staff across the health system. So we understand that problem. There are constraints. We're through policy and practice and cooperation addressing it.
Tim, I guess this is a question for you. How is the county, are they ready for goods to be, running out? Is the county seeing goods being run out? And are you guys thinking about doing things like maybe elderly hours only in at grocery stores and stuff like that with all the dying?
There's been no discussion of that at this point, and as you're aware, we have limited resources with respect to retail establishments. We really have two major grocery suppliers in the county. We're hoping that some of this is self-correcting. The legislature is meeting at 3 o'clock this afternoon to discuss issues that may involve additional special orders, per the state of emergency. But at this time, we haven't received reports of any food scarcities or hardships other than the typical shortages that you're seeing. I will add, though, that the Attorney General has established a hotline, and the number I wrote down and left in my paper somewhere, for anyone to report price gouging. If you're seeing that anywhere, the hotline certainly is an option, or you can contact our offices directly, and we will act on your behalf. Unfortunately, there have been instances. We certainly don't feel that that should be condoned, and we condemn it, in fact, and would encourage people to notify us should they experience it.
This may be for Deborah. You said there's no mandatory quarantines, but how many people may be on volunteer quarantine at the moment?
So whenever we have someone who is presenting with symptoms and they're going to be tested, they are put on a voluntary quarantine until we receive the results of their test.
And are any of these county employees?
Not at this time.
I'm sorry, I'm just going to keep going. Sheriff Hessman, I'm sorry. How about folks that are in the jail? I know you're limiting how many visitors they can have, but has anybody, any of them have been tested or quarantined within the jail?
At this time, no one's symptomatic in the jail, and the state has suspended all intermittent jail sentences, so people that come in for weekends or for a day, they will not be coming in, so that reduces the risk of infecting anyone in the facility. We have a screening process in place. When we do have a commitment to the jail, and they will be screened with a questionnaire, their temperature taken, and they will be put in isolation for a period of time.
And does this extend to staff that will be coming in and out of the jail?
The corrections staff will be screened daily, their temperature taken prior to them entering, just as a precaution. We're working on that now.
mentioned the website, there's information on the website, but my colleague is letting me know that they're having difficulties finding information on the county's website. Could you clarify maybe where that would be
It
located?
should be right on our homepage. As I left the office, I was actually asking my assistant to post it, so if it's not, it will be imminently. But we have an emergency alert bar across the top of our website. That should be where the link is, and if it's not, now it will soon be. So.
And those testing
Sites?
sites, are
Sure.
those the same thing as those drive-through testing sites?
They're a little bit different, and I wanted to emphasize, this is a place where right now we're fulfilling a provider's order. So typically, when you think about drive-through, there's the aspect of it being public-facing and someone can come without having engaged the healthcare system and just show up. With an order, we do accomplish that with a drive-through mechanism. So we're trying to limit that contact event that causes, if they come in the building, the staff to don PPE and to clean the room. If we do it out of someone's vehicle, that's easy. But what we end up doing in Ithaca now is we're fulfilling an order where there were some questions and some context. It's also out of the reality of our supplies of testing kits, of sampling kits, swabs, viral media, and so on. And so as soon as we have sufficient supplies, we do intend, but we're not there yet, to open a public-facing drive-through that would be a larger scale. And so we're working on that.
So just to clarify, you are able to do the test, but you can't actually process for the results, is that correct?
We collect the sample. We call it a sampling site specifically because the test is done in a molecular lab at one of the large labs, either government or private.
And where are those tests being sent to?
It's any combination of Wadsworth, which is the New York State Department of Health, or through the Mayo Clinic, Quest, LabCorp, and there's other test sites that are being opened up. So I believe there's large urban centers like SUNY and University of Rochester. I think Rochester Regional has a testing site that's either currently or imminently going to be active. So this is where you hear on the nightly national news that testing is expanding. It's really at that central location. Sampling continues to be challenged, and that's getting concentrated with state supplies at large urban areas that are deemed hotspots. And so thankfully, this is not a hotspot. Unthankfully, we have to wait to do some testing some sampling that we'd like to do to get a better idea of the incidence and prevalence of the disease in this community.
I have a question for Tim. The essential workers, if someone is to test positive that has been around the essential workers, will the workers be notified that someone has been in the building or so forth, that we've been exposed?
Absolutely. It's probably more of a question for Deb, but regarding the protocols for responding, absolutely, they are in place and will be strictly adhered to.
Yeah. We would be working to get a list of who that person may have had close or proximate contact with, and then we would be speaking with the individuals that were identified as having that contact.
And a follow-up to that, you had kind of mentioned the county building. What are the screening processes going to be in this building for people to get in?
There won't be anything beyond the posting at the doors to come in. The security staff will have a heightened sense of awareness for people coming in, but there will not be any aggressive screening in this building at this time.